Our topic is National Population Policy 2000, and here are our group members. And my name is Divanshu Prajapal. So first we will go through what is population policy. Measures like these are different terms according to different authors and different situations. So first is uh, uh, like the influence of different distribution and composition of human population, and how government is dealing with that is called population policy. The second one is from Organsky in which was in 1961. It simply tells that a deliberate effort by a national government to influence the demographic variables like fertility, mortality, and migration. And third one is also a set of coordinated laws aimed at reaching some demographical goal. So this is like population policy. So like every other policy, the policy has some stages of processes. So the first one is problem identifying and issue recognition. The second is the policy formation, then implementation, then evolution. uh, the population policy which lie in the criteria of health sector. As you can see, there are like two other policies also. So there is a question like why there is a need of a population policy for India, because it's a very obvious to say that like if we have limited resources and we have limited population, then we can divide between them. Uh, so this is the need of population policy in India. Uh, Here are some supporting evidence for it. Like on 11th May 2000, India had 1 billion population, and 16% of total worldwide population, where the land area is only 2.4%. And if the will pass 2045 as per the projection was in year 2000, but we have according to some unofficial sources, we have already passed China. And also we can see some other supporting evidence global population will grows three-folds in this century, but our population grows nearly 5 times. So these are the need of here you can see some supporting data. Same in this slide also. This is a growth rate in every 10 years. And here we can see that after the adopting the population policy, we can see a little decline in the population growth rate. Previously it was 21%, now it is 17%.
Here are some causes of why we have having high population growth. So first of all, we have a large size of population in a reproductive age, that is from 16 to age of 40 or 42, and we have a higher fertility due to contraception, and some of the other really social ethics, we prefer male child over girl child. So these are some causes that really I think really are the reason behind we have this population growth. And now we will go through some of the roadmap how national population policy grows and evolve. So in 1940, a subcommittee of population appointed by the National Planning Committee as limiting the number of children, and it is in the interest of social economy and family happiness. And in 1946, we have a board committee that actually reported a report majoring in the control of disease and feminism, and also highlight some causes and some serious problem why our population grows so drastically and dramatically. So, and after that, in 1951, there is a draft recognized as a population policy as it was a very essential step towards a national population policy. And in 1952, we launched a very first national family planning program in India. After that, in 1976, our Minister of Health and Family Planning, Srish K. Singh, declared that population growth events that statement behind national population policy. A revised in a population policy will be tabled on the Parliament in 1977, and then in 1983 we have emphasized on the small family norms and describe some rules of describe some rules and effects of how this growth of population, this drastic growth of population will affect us. And in 1991, and Shri K. Kanukaram as the chairperson of the Committee of National Development Council states some of the proposed formulations behind national population policy. In 1993, we have Dr. M.S. Swaminathan, who drafted the very national population policy. And these are some of the other important dates that actually are behind the success of national population policy. And
Background of 1976 population policy. In 1976, with India's population growing rapidly, the emergency extended for another year. Minister of Health and Family Planning Karan Singh announced national population policy to deter population growth. The policy hoped to reduce national hardship, established how incentive would be allocated to those who participate in a population management efforts, and thought to reduce the national birth rate from the 35 to 25 per thousand by 1944. The policy also acknowledged that the country's population growth concern could not wait for increased development and education to result in a fertility drop. The policy called for the education ministry to encourage and promote girls' education. The population policy started that the central government did not wish to legislate compulsory sterilization, but if a state legislature felt prepared to pass policy making sterilization compulsory, then it could do also. The result of population policy 1976, if measured by the number of sterilizations, would be success. From the right based perspective, when effectiveness is measured by deaths, violence, or a right compromise in impact of the goal of population policy initiative were unsuccessful. Fail was reflected by the lack of sustainability and being counterproductive to improve national health. For example, compensation for sterilization operation rose to 10% the total health budget. It concerned resource at one place. More of the health professionals were being used to reach sterilization goal rather than other service toward the patient's welfare. This is a demographic achievement of India before NPP National Population Policy 2000. Objective of the National Population Policy 2000. Immediate objective to address the unmet needs for contraception, healthcare infrastructure, and health personnel, to provide integrated service delivery for basic reproductive and child health care. Medium term objective to bring a TFR to replacement level by 2010 through vigorous implementation of intersectional operation strategies. Long term objective achieve a stable population by 2045 at a level consistent with the requirement of sustainable economical growth, social development, and environmental protection.
National Social Demographic Goals for 2010. So here are total 14 goals for this work. First goal is address the unmet needs for basic RCH service supplies and infrastructure. Another goal is making school education up to age of 14 free and compulsory and reduce dropout ratio from primary and secondary school levels to below 20% for both boys and girls. One is reduce IMR to 30 by 1000 live birth. reduce MMR to less than 100 per 1000 live birth. Another is to promote delay marriage for girls at age not less than 18 and preferable age of 20 years. Achieve 80% institutional delivery and 100% by trained personally. Achieve universal access to information counseling services for fertility regulations and contraceptive with wide basket of choice. Achieve 100% registration of birth, death, marriage and pregnancy. Prevent and control of communicable diseases. Promote small family norms to achieve a replacement level of total fertility rate 2.1. Bring our convergence in implementation of related social sectors programming so that family welfare become a people-centered program. Now, major strategies themes for the NPP 2000. Strategy themes must be simultaneously pursued in standalone or intersectoral programs in order to achieve the national socio-demographic goals for 2010. Following strategy themes are presented in the policy, like decentralized planning and programming implementation, availability of services delivery at village level, empowering women for improved health and nutrition, child survival and child health, meeting the unmet needs for family welfare services. Greater emphasis for underserved population group like urban slums, tribal communications, adolescents, and increased participation of men in planned parenthood. Deserve health care providers. Collaboration with the commitments from private agencies and NGOs. Involvement of national system of medicines in delivery of RCH services and other like information education and
Okay, now let's talk about the new structures of national population policy. The NPP 2000 is to be largely managed at the Panchayat and Nagarpalika levels in coordination with concerned states and union territories. For comprehensive and multi-sectoral coordination of planning and implementation between health and family welfare on the one hand, along with schemes from various other departments like education, nutrition and women and child development, etc. For these, the following structure has been proposed. Now, promotional and motivational measures for adoption of the small family norm. Panchayat and Jila Parishad will be rewarded and honored for exemplary performance. Balika Samriddhi Yojana. Under this Yojana, women will be provided with cash incentive of rupees 500 at the birth of girl child of birth order 1 or 2. Maternity benefit scheme, in which women will be provided with cash incentive to the mothers who have their first child after 19 years of age for birth of the 1 and 2 child only. A family welfare linked health insurance plan will be established. Couples below the poverty line will be rewarded for their active involvement in family planning activities. Village level self-help groups will be set up. A wider and affordable choice of contraceptives will be made accessible. Innovative social marketing schemes will be promoted, and ambulance services at the village level will be strengthened. Strict enforcement of Child Marriages Restraint Act 1976, strict enforcement of the Prenatal Diagnostic Act 1994, soft loan to ensure mobility of the ANMs will be increased. So now let's talk about some of the operational strategies. Villages self-help groups to organize and provide basic services for RCH care combined with ongoing ICDS scheme. Implement at village levels a one-stop integrated and coordinated self-delivery package for basic health care, family planning and MHCH care. At village level, the Anganwadi center may become the pivot of basic healthcare activities, contraceptive counseling and supply, nutrition education and supplementation and preschool activities. Establishment of maternity hut in every village with equipments, supplies and medicine for safe delivery. Trained birth attendant and traditional days should be made familiar with emergency and referral procedures. provide wider basket of choices in contraception through innovative social marketing schemes to reach household levels, improve district, sub-district and panchayat level health management, strengthen community health centers and primary health centers to provide comprehensive essential and emergency obstetric and neonatal care, strengthen skills of health personnel through various training activities, focus attention on men to promote the small family norm, sensitize, train and equip rural and urban health centers and hospitals toward providing geriatric health care.
Now let's talk about what were the targets which were set in National Population Policy 2000, and what are the targets which are being achieved till now. So if we talk about the various indicators, the first one is the population which we have targeted. So the targeted population in the policy by 2010 was 1107 million, and the current status which was in 2007 was around 1103 million in 2005 and 1210 million in 2011. So the population target were majorly achieved. So if we talk about the another indicator, that is reduced drops out as a primary and secondary school levels. So it was less than 20% for both boys and girls, which was targeted in the policy. And if we talk about the current status in 2007 school attendance, the 6 to 10 years students were 83% attendance, 11 to 14 years 75%, 11 to 17 years 41%. And if we talk about the infant mortality rate, less than 30 per 1000 live births were targeted, and the achieved growth was around 57 per 1000 live births. And if we talk about the total fertility rate, it was targeted to be 2.1, and the achieved one was 2.9. So majorly the national population policy was a great success, and we can see all the other indicators over here, and almost all were majorly achieved. And if we talk about the different indicators with the different policies, so there are different policies like 10th plan goals, RCS2 goals, and the one which is National Population Policy 2000 goals, and the Millennium Development Goals. And if we talk about all the indicators and what were the targets and what were the targets which were set to be achieved. So in infant mortality rate, which the 10th plan goal, which was introduced in 2002 to 2007, less than 45 per thousand mortality rate was targeted. In RCS2 goals, less than 30 per thousand was targeted, and in NPP 2000, less than 30 per thousand was targeted. And if we talk about the other total fertility rate, then in the 10th plan goal it was at around 2.3. In RCS2 goals policy it was 2.1, and in NPP 2000 it was 2.1. So majorly these were all the targets which were set by the different policies to get the population in the proper manner. And we can see all the other different indicators which were set. And in the conclusion, as you know, the population plays a very important role. The well-being of the people and their health, education, nutrition, civil and political liberties led to the growth in the country and its economic stabilization. In India also, we know that India is also known as a young population. So we can ensure that the various policies which were introduced for the population was a major success. And in India also, vast majority of population would become assets. So we can see the young population is the asset for us right now. And also the population stabilization and would be successful only if the action plan contained in NPP 2000 is pursued in national movement. So it was a great success overall. So these are the different references which we have used for making this PPT. There were various policies introduced by the government which we have taken as a reference, and different articles and all the other websites which we have used as a reference. Thank you.